Hello and welcome to another episode of your show, Medical Talk. I'm Dr. Mohammed Al-Mahtab. Headaches are one of the most common medical complaints worldwide. It is estimated that up to 75% of adults experience a headache at some point in their life. They can arise from various reasons and present in different forms, causing inconvenience and disruption to daily life. Headaches can be a symptom of a wide range of underlying medical conditions, including high blood pressure, infections, and neurological disorders. Research has shown that stress can be a major trigger for headaches, with some studies suggesting that up to 80% of headaches are stress-related. Migraine, on the other hand, is a very common condition. And according to WHO, migraines are the third most prevalent disease in the world, affecting around 1 in 7 people globally. Understanding the different types and causes of headaches is crucial in finding effective remedies and preventive measures. After the break, we will be learning more about headaches with our guest, Dr. Goran Nikolowski, a Senior Registrar in Neurology. Stay tuned.
Headaches are an extremely common ailment, experienced by people of all ages and backgrounds. Almost everyone has experienced a headache at some point in their lives, making it one of the most prevalent health complaints worldwide. Regardless of cultural or geographic differences, headaches are a universal phenomenon that affects millions of people on a daily basis. This shared experience underscores the commonality of headaches and highlights their significance as a global health concern. There are several reasons why people experience headaches. One common cause is tension headache, which is often triggered by stress, anxiety, or muscle tension in the head and neck region. These headaches typically produce a dull, aching pain that can be felt on both sides of the head. Another common type of headache is the migraine, characterized by severe throbbing or pulsating pain, often accompanied by other symptoms such as nausea, sensitivity to light and sound, and visual disturbances. If headaches persist or significantly impact daily life, seeking medical advice is recommended for proper diagnosis and treatment.
Welcome back. We are honored to have with us in the studio Dr. Goran Nikolowski, a Senior Registrar Neurology. Doctor, welcome to Medical Talk.
Thank you very much. I'm happy I'm here. I hope I will contribute to understand the neurology more than usual.
Thank you so much. Now, we have so much to talk about, but I think it's fair to start with giving like a very brief definition to our viewers. What do we mean by the field of neurology?
Neurology is dealing with the diseases and conditions of nervous system, which consists of 3 parts: central, peripheral, and autonomic nervous system. And because today's topic is headache, all of that parts can cause some type of headaches.
Exactly. So there are, as we know, there are so many types of headaches, but can we define them into certain types or classification?
Actually, I find some data, some statisticians that headache is the most frequent symptom patient complaining in the clinics. And there are, I don't know, maybe more than 100 types of headaches. We have classified them basically in primary and secondary headaches, which means that primary headaches are headaches by itself with no other background. But secondary headaches are headaches which are caused from some other disease or condition in our body.
I understand.
And the three main types of primary headaches are migraine, I think it's more famous, than cluster headache and tension tip headache. And secondary headaches could be various type of headaches caused by diseases in the eyes, ears, sinuses, other parts of our body. So this is a really wide topic to go deeper in.
But in your opinion, what is the most serious type of headaches?
I cannot say which one is most serious, but one of most frequent headache, and the headache which is causing serious disability and disturbance of activities of daily living is migraine. Some data shows that even around 20% of all population suffering from migraine, diagnosed or not diagnosed. But migraine is probably very frequent and very serious headache. Also, cluster headaches are serious in the sense of their intensity, but they are very rare in comparison with migraine. From the other side, tension type headaches are probably most frequent headaches, but they are most light headaches, and they are not causing disability and disturbance of daily activities, serious disturbance of daily activities.
So there are some typical triggers for headaches, as we know. Can you explain to us what are the most common typical triggers for headaches, and how can that actually affect the individual?
Many factors could be triggers for headaches, like headache caused by cold is known, headache caused by sexual activities, headaches caused by extreme physical effort, and many other factors. But what is also wide accepted, that some food causing migraine attacks in people with migraine. Actually, the new data showing that this is not so important in the frequency of migraine attacks. Still, some types of fish, some types of chocolate, cheese, and some other food can be trigger for migraine attacks. More important, in my opinion, the hunger is higher trigger than some food. So people frequently avoid to eat food because of that fear of headaches, but this is the most frequent trigger for migraine headaches. Also, lack of sleep could be trigger for migraine and some other type.
What about the lights and the noise, the auditory system, basically? Can that actually cause a headache?
As I know, it could not cause headache, but the people with attacks are not comfortable with light and noise. So basically in the classification, definition of migraine, light and noise discomfort are some of criteria.
Okay, so we know that headache by itself is just a symptom. It could be an indication for a very serious underlying condition, right?
Of course. So when we are speaking about migraine cluster and tension type of headaches, this is a primary, they are primary type of headaches, and they are not symptom of other disease. But many other headaches are symptom of some other diseases, and that headaches we are naming symptomatic headaches. Rare, but they can be serious sign of serious, actually could be sign of serious disease, including in some cases brain cancer, which
Exactly.
should be most serious.
Exactly. What about, like, for example, blood pressure? High blood pressure. Could that actually lead to also severe headache?
Yes, it's known, and I faced in my practice that the patient are coming in neurological clinics because of headaches before they are diagnosed as hypertensive patients. So headache could be one of the initial signs of hypertension.
What about the younger generation, for example, like 15 years and below? Are they basically prone to also have severe headache episodes?
Again, as I know, there is no some age distinguish regarding headaches. It's known that migraine is always migraine has onset at younger age, before 20, before 18. Even I met some patients with age of 11, 12, they have onset of migraine. From the other side, tension type headaches are more frequent in some adulthood, when the people are more active and exposed to more stress. And basically in older people, the symptomatic headaches are more frequent.
Exactly. You mentioned also earlier the lack of sleep basically could be a trigger for headaches, right? In your opinion, what is the normal sleeping hours, the enough sleeping hours basically one should have?
This is very difficult to give answer on these question, but basically night sleep we are considering as normal, as physiological. But I know many people, they are active during night and they are sleeping during day.
Right.
And this is one of the triggers for headache.
Exactly. So shifting the working hours from night to morning, basically. Sleeping in the morning is different than sleeping at night.
Absolutely, yes. People who are working in shifts, they have slightly higher risk for headaches.
Exactly. It's very challenging. Well, we have more to talk about, but we have to take a short break. We'll be right back. Welcome back. We're still talking in the studio with Dr. Goran Nikolowski. Dr. Goran, before the break, we were talking about migraine and headaches, but I think a lot of people, they don't know how to distinguish between having a migraine. Am I having a migraine, or is just a normal, for example, tension headache? So how can one distinguish between two?
I would like to say that sometimes it's not easy to distinguish migraine from the other headaches. Also for the professionals, for the doctors, not for the patients. people without medical knowledge. But when we are facing the classical migraine, it's quite different than other headaches. This is a unilateral, always unilateral headache, so affecting only one side of the head. And I'm speaking about classical headache. It's throbbing headache, not tightening or some other type of headaches. Then very frequently it's associated with nausea and vomiting, with, as we mentioned before, light and noise discomfort. Onset is in younger age. The headaches usually starting in the morning, and sometimes they're lasting with hours or with days. This is a typical form of migraine, but also there are different type of migraines. Sometimes we can make some mess, even the professionals, in between migraine and some symptomatic headaches. We are considering symptomatic, like patient with chronic sinus inflammation, either allergic or some other cause. Some other type of headaches, sometimes it's different to recognize at the beginning that it's migraine.
Exactly. And does it, for example, affect one side of the head? For example, people may actually complaining like, I'm always feeling this pain on the right side more than the left side. Is that also one of the common characteristics of migraine?
This is not typical for migraine to affect always the same side. Sometimes it's on the left, sometimes on the right side. I met the patient with more frequent headaches on one side, but I don't remember that I had patient with migraine with headaches exclusively on one side. But I would like to mention again that migraine could be also bilateral, could affect both sides,
Exactly.
whole head.
But because the reason I ask you is because is the place of the pain, basically, that coming from the headache, is it relative to, for example, from a neurological standpoint, is it relative to you that to see, like, if this patient comes in with the left side always, that means it could be an indication for something else? Or is it basically because of, like, for example, if somebody with an eye problem, they might actually have a headache on the back of their head, for example?
Correct. If headaches is always on one side, then it's indicated that maybe there is some underlying cause for that headache. It could be eye problem, it could be sinus problem, it could be some space occupying lesion inside the head, or some other reason. Sometimes the patient by itself, they cannot recognize that pain is coming from the neck, actually. Patients with cervical disc, with disc in the neck, frequently they have headaches on one side, but this is basically posterior headaches on the back side of the head.
Is there a preventive route in terms of medications that the patient can take these medications basically on a regular basis to avoid having a migraine attack?
Yes, I prefer when I speak about the treatment to speak about to see the white than usual, to speak about the medications and to speak about lifestyle, because we are unique and we cannot divide one part of our body, even its head, from the other part of the body. We cannot divide our body from our mind. So There are few medical strategies for prevention of the migraine. I think this is not the place to speak about that, to mention which medications, but also lifestyle, a slight of holistic approach
Yes.
is also very important in migraine patients. What it means? It means that I know that it's sometimes it's trivial to say, and it's difficult to establish that in the practice. But I'm pretty sure that there are ways to reduce the stress, which is very important in migraine patients. Then we already mentioned the regular sleep circadian, then some relaxing methods in the treatment of migraine are also very important.
And changing your lifestyle, basically,
Changing of lifestyle,
to the healthy style.
absolutely.
If you have one last short advice to our viewers, what would it be?
I will maybe repeat myself, but I will say we cannot divide our body and our mind. So the treatment of migraine, and in my opinion on almost all diseases, could not be just medical and we did our job. My advice is don't give up. There is a way for treatment for migraine. And my advice for the potential patient is please do not hesitate to visit doctors, to visit neurologists, to pass through the evaluation of the condition and to go under the whole treatment.
Thanks. Thank you so much for your time and for all the valuable information that you shared with us. And hopefully we'll be able to have you again with us in the studio in the future. Thank you so much, Doctor.
It would be my pleasure.
Thank you so much. Dear viewers, we still have more interesting reports, but after the short break. Well, after we talked with Dr. Goran about headaches and migraines, we have a little report to watch with you, so let's watch together.
Greetings. My name is Dr. Abbas Johar. I'm a neurologist working at Amiri Hospital. Today I'm glad to speak about an important topic, which is headache. By definition, headache is any pain or discomfort from the neck and above. For example, if a person has a neck pain or a tooth pain or a toothache, we consider that as a headache. So headache is the most common symptom in human beings. I would doubt that any person will never have a headache in his or her life. The most common cause of headache is what we call tension headache. Typically, it's a headache that involves the whole head, and it happens to all of us because we don't sleep well, we are hungry, we have low blood sugar, and so on. But the most common headache that brings the patient to the hospital or to see a neurologist is called a migraine headache. So a migraine headache, it is typically happens in half of the head, not all the patient, but the key characteristics of the headache is a throbbing sensation. It pulsates like your heartbeat. It is typically associated with certain bothering symptoms, especially nausea, sometimes even vomiting, sensitivity to light. The patient who has an attack, they don't like to be exposed to specifically to the direct sunlight. They want a dark and quiet room. There are many ways to treat headaches. Number one is painkillers, simple analgesias like Panadol, and like muscle relaxants like Muscadol can help as well if there is neck stiffness or neck pain with it. There are some other medications that might be slightly powerful and they are available over the counter, like ibuprofen, which is one of the best treatments for migraine attacks. We have Proxin or naproxen, and so on. We call these categories as NSAIDs, non-steroidal anti-inflammatory drugs. Rarely, if you go beyond this, the headache will improve. And this is the most likely time that you will need to be evaluated by your doctors. Any doctor can evaluate migraine. The doctor in the primary health care center, an internal medicine doctor, and even a neurologist can see any type of headaches. So there are certain things that may trigger headaches. Number one, as we mentioned, lack of sleep, the problem of having not enough sleep, dehydration. So just a small tip for you, try to delay your morning coffee step by step and drink plenty of water.
Physical activity plays a crucial role in maintaining a healthy and stronger body. Regular exercise can improve health, reduce the risk of many diseases, and boost mental health. Engaging in physical activity triggers the release of various hormones that play crucial roles in optimizing our performance, energy levels, and overall well-being. Even a small amount of physical activity can have a significant health benefits, making it accessible to all ages and fitness levels. Now, let's watch a short report about some physical activity. Stay with us.
Hello everyone, Coach Omar here again. Today we're gonna do a different type of HIIT exercises. As we all know, HIIT stands for High Intensity Interval Training. It can be simply defined as a high intensity interval training, which means that you will train for high intensity of levels and then you're gonna rest at lower intensity levels. It's so simple that you don't need equipment, so there are no excuses. Once again, you can do it at home or at the gym when you are having your headphones on and ready to get that pump going. It starts with high knees. You're gonna stand in your position and lifting up, alternating your knees up and high as a warm-up and starting to feel your legs burn. You're gonna do it for 30 seconds and you're gonna rest for 20 seconds and hit the next exercise. The second exercise, which is squat pulses, you're gonna stand shoulder width apart and you're gonna turn your toes to slightly face outwards. And then slowly start lowering your body deep enough so that your legs are parallel to the ground. And you're gonna maintain this position for 30 seconds and then you'll feel your legs starting to burn. Maintain this position for 30 seconds and then rest for 20 seconds, and hit the next one. The third exercise will be hip thrust bridges. You're gonna lie in a supine position on your back on the ground. You're gonna alternate your kicks between the right leg and the left leg. It's very strong. It's a very strong exercise for glutes. And remember, strong glutes can only indicate a healthy spinal cord. And then you're gonna do this exercise for 30 seconds, and then you will rest for 20 seconds and head for the fourth exercise. As for the fourth exercise, it's Russian twist. It's a superb core exercise. It will build your muscles that stabilize your spinal cord. You will lie on the ground and slightly lift your body upwards and then start rotating to each side. Keep repeating this exercise for 30 seconds and then rest for 20 seconds and then hit the last exercise. The fifth and last exercise is push-ups. We all know push-ups. You need to lie on the ground with your hands shoulder width apart, and you just starting pushing the ground with your hands. If you are unable to do a single push-up, you can just modify the exercise into resting your knees to the ground, and you can just perform it for 30 seconds and then rest for 20 seconds. And there you go. You have your 20 minutes workout, no equipment needed, which means that you guys have no excuses not to train. Remember, eat right, sleep like babies, and train hard. El Captain out.
Well, that's it for our show today. Thank you for watching Medical Talk. Until we see you again, please stay safe and stay healthy.